May the Lord add his blessings to the words of my mouth and the meditation of my heart. Amen.
Amen. Well, so this morning we have a presentation, and I will not do any promo this morning. I will not even go into the word to the wise. I want to introduce, a counselor psychologist and family life coach, who is Mrs. Angela Rizama Clement. And I'm happy to have her with us this morning. She holds a Master of Arts in Counseling and Psychology and a Diploma in Clinical and Pastoral Counseling. She's also a registered nurse, licensed midwife, and co-author, and married for the past 38 years. Ms. Rizama is a devoted wife and mother of 2 adult daughters and 1 granddaughter. She's an avid reader who also enjoys singing, listening to music, scrabbling, gardening, and traveling. Angelique is passionate about teaching parenting skills, women's health, motivation families, and empowering young persons to succeed. She founded exclusive counseling and life coaching services, and she will tell you as we go on how she can be contacted. Angelique, good morning and welcome to Victorious Lifestyle. I'm frog in my throat.
Good morning. Good morning. Thank you so much for the opportunity to share.
No. You have it all wrong. I'm the one who ought to be thankful this morning. So I am the one who ought to be thankful. And I know my listeners, they also will be thankful. So how are you? How are you? How are you? How are you, Angela?
This morning. Thank you.
Yes. So I'm going to give you, I have you as the co-host. So I'm going to give you time now to set up your PowerPoint, and you can go right ahead and do what you want to do. Nice. And you can begin. I will interject only when I feel it fit and necessary. So you can begin as soon as you are ready.
Okay. Good morning, everyone. Good morning, and welcome to the platform this morning. We are going to be looking into breast cancer this morning, and I'm going to start by sharing some statistics with you. Okay. Did you know, according to the World Health Organization, that 1 in 8 women will be diagnosed with breast cancer in her lifetime? So let me go back to the picture before. Look at these beautiful women. Can you look at any of them and think that they have breast cancer? No, they all look lovely, they look healthy, they look strong. So a lot of women are walking around with breast cancer and they are not aware of it. Now, this is the most common cancer among women worldwide and claims so many lives. When caught early, breast cancer has a 98% survival rate, so that's the good news. Nearly 85% of women diagnosed with breast cancer do not have a family history, and you need to, pay attention to that. They do not have a family history. 64% of the cases are diagnosed at a localized stage, and that's when there's no sign that cancer has spread outside of the breast. So remember that for later on. Although very rare, men are also being diagnosed with breast cancer too. So men, this is for you this morning also. Let's take a few minutes to look at the anatomy of the female breast. Number 1, we see that's the chest wall. So this slide is very important. Later on, you'll understand why this slide was so important to know these structures. So number 1 is the chest wall. Number 2 is the muscle. Number 3, which is here, these are the lobes. Number 4, the nipple. Number 5, the areola, which is the dark area around the nipple. Number 6, the ducts. These are the ducts here leading to the nipple. Number 7, the fatty tissue here. And number 8, the skin. Now, the difference between a male and female breast is the amount of fatty tissue that makes a difference in the breast, the fatty tissue. Okay, so breast cancer. What is breast cancer? This is a disease in which malignant cells form in the tissues of the breast. most commonly either in the milk ducts or the lobes. Hence the reason for showing that first picture of the anatomy. Now, the types are ductal carcinoma, which means that they originate from the ducts, or lobular carcinoma, which means that it originates from the lobes. So this can either be invasive or non-invasive. So what do we mean by non-invasive? Non-invasive is when the cancer is still inside its place of origin and it has not yet spread to the other areas or broken out. Invasive, this means that the cancer cells, they broke out from the inside of the lobes or ducts and they invaded the nearby tissue. Now, how does this happen? These cells can travel through the bloodstream or the lymphatic system to other parts of the body, and they can reach the lymph nodes, eventually making their way to other parts like the bones, the liver, the lungs. And this is when we say the cancer has metastasized. Now, who is at risk for breast cancer? Women who are older. If you look at any disease, you would see that as you age, you are at higher risk for that disease. Women who carry the BRCA1 and BRCA2 gene, they are at an increased risk for breast cancer. Now, although I mentioned before that you may not have a family history, we have found that women with a family history of breast or ovarian cancer is at a higher risk of breast cancer. Now, there are also some personal factors. Women who started their period before the age of 12, which is called the menarche, and women who have menopause after the age of 55, they are also at a higher risk for breast cancer. Women who are overweight, those who would have used hormone replacement therapy, those who would have taken birth control, drink a high amount of alcohol, women who have had no children, or they would have had their first child after the age of 35, or women who have very dense breasts. So this is a list of persons who are at a higher risk for being diagnosed with breast cancer. So let's talk about the breast self-exam. Now, this breast self-exam is a method used to attempt to detect early breast cancer, and it involves looking and feeling at each breast and underarm area for possible lumps, distortions, or swellings. Now, not every cancer can be found this way, and later on I will share an experience that I had with a client. Not every breast cancer will be found this way. However, the majority of breast cancers have been found by doing the breast self-examination. Now, who should do this breast self-examination? Women are advised to start this from the age of 20, and also men, they advise to start from that same age. And this normally helps you to know what your breasts feel like normally. Now, if you're examining your breast every month, you would know exactly how your breast feels. So any difference, anything that's strange, you'd be easy to identify it. Now, this is best done after your cycle, because a lot of women experience pain and discomfort just before and during the cycle. So after the cycle is the best time to do this breast self-examination. And you want to do it every month around the same time. For women who have had menopause, we ask that, you choose a day, probably beginning of the month or the end of the month, sometime that you would remember to do this breast self-examination. Now, the nice thing is that most persons are in the privacy of their home, so it's easy for them to follow the instructions and to do the breast self-examination with me as we go along. So you need to do this standing, and you also need to do it lying. Now you're using the 3 middle fingers and you're using the ball of your fingertips. So with the fingertips close together, gently probe each breast in one of the 3 patterns. There's 3 patterns that can be used. So you can use all 3. You can use which one is most convenient for you, which is most comfortable for you. The first one is a circular motion where you start from the middle and you go around, making small circles until you cover the entire breast. The second pattern, you start on the outer breast, going down, then you go up and you go down, using the same 3 fingers gentle pressure. And the third method is where you examine your breasts going from out to in and then back from in to out. So some women try all methods. It's what's best for you. So you also need to do this exam whilst you are lying. So with the fingers close together, you're gently probing each breast, as I said, in one of the three patterns. So let's look at step one. You need to look at your breast in the mirror with your shoulders straight and your arms on your hip. Look for any unusual size, any unusual shape, color, without visible distortion or swelling. So you're going to look with your hands on your hip, and you're also going to raise your hands above your head and examine your breasts. See if there are any changes. Step two, you're looking for any signs of any fluids coming out of your nipple. Now, if you're not breastfeeding or you just had a baby, you should not have any fluid coming from your nipple, whether it's watery, milky, yellow, or bloody. The photo below shows the actual picture of someone's nipple that was abnormal. The photo below. Ensure to examine the nipple, the areola, which is the dark area around the nipple, squeezing the nipple during the examination. Step three, you need to feel your breast whilst lying down. So if you're going to be examining your right breast, you need to have a small pillow under your right breast. You need to elevate your right arm under your head and examine with your left arm. And you would do the same for the other breast. So if it's your left breast, you're going to place a flat pillow under your left arm. You're going to elevate your left arm and examine that breast with your right hand. Remember to use firm, smooth touch with the pads of your fingers, keeping them flat and close together in a small circular motion about the size of a 25 cents or a local 25 cents. You want to cover the entire breast right up to the collarbone and under your armpit. Why am I saying that? Because your breast tissue begins right under your collarbone and under your armpit. So any lump under your armpit should not be ignored. You know, sometimes women will say, you know, I had a lump under my arm, but I thought it was from shaving, or I thought it was from waxing. And we have found a lot of women with lumps under their arms, and when they were examined, they were positive. Okay?
Angelique,
Yes?
earlier on, you said men also can have breast cancer. But
Yes.
is this the same technique a man should use, seeing that his breast will be more closer to his body than a woman?
Yes. Same technique.
Same technique.
Same
Okay.
technique. Right.
So you're advising men to do it?
Yes, from the age of 20, we advise men to do the same thing because we have men now being diagnosed with breast cancer.
Okay, then. Thank you.
You're welcome. So step 5 says that the vertical approach seems to work best for most women, but as I said before, it's up to you to choose whichever method is most comfortable for you. And you need to remember that you check from under your collarbone and right under your arm. Step 3, feel your breasts whilst you are standing or sitting. And this picture shows a lady in the shower. Now, many women find that it's the easiest way to examine their breasts, because when you're in the shower, your skin is wet and it's slippery. And I actually knew a client who shared her experience with me, and of course she would have given me permission to share with other people. She was having a shower one day, and she said one of her grandchildren removed the washcloth from the bathroom, and she was so angry, she was so annoyed. They moved it, and she's calling now for someone to bring one for her, and nobody's hearing her. So she went ahead to have her shower. And on that day, having the shower without the washcloth, she felt a lump in her breast. So that was actually a blessing for her. And on investigation, it was cancer. So since then, she has been treated for 5 years, and she's doing very well. So in the shower is a good opportunity when your hands are wet and slippery to do this examination as well. So this slide here, normally I ask people to respond, but I'm not sure how many persons would be able to respond from where they're viewing. So this is just a recap. So in this picture, we're seeing here that this is redness. So we're looking at the different changes that can happen. You can have dimpling of the breast. You can have a lump. You can have nipple retraction when the nipple goes back. You can also have changes in the skin, and sometimes the skin looks like orange peel and the pores are very open. You can have discharge other than milk. You can have changes in the areola, which is a dark area around the nipple, or you can have pain. And sometimes patients will say, but I thought when you had pain, that means it's not cancerous. That is not true. Some persons have pain. So let's look at where the cancers are found. Well, the cancers are most likely to be found in some part of the breast. And what we have found, half of all the cancers are found in the axillary tail. So I want you to imagine dividing your breast into 4, and we will go on to see how high the percentages are in each area. So let's divide your breast into 4. The part that is nearest to your arm, the highest part, that is the upper outer quadrant. The part that is nearer to the next breast, we call it the inner upper quadrant, or the upper inner quadrant. The part that is below, nearest to your arm, we call that the lower outer quadrant, and the part that is below, nearest to your other breast, we call that the lower inner quadrant. So let's just go over that again. So what we have seen is that 41% of the cancers are found in the upper outer quadrant, which is the part that includes under your arm, which is called the axillary tail. So it's so important that you examine the axillary tail, which is the extra tissue under your arm, where your breast joins under your arm. 14% is found in the upper inner quadrant, 5% in the lower inner quadrant, and 6% in the lower outer quadrant. 34% is found behind the nipple. Yeah, so take note of that. 41% in the upper outer quadrant and 34% behind the nipple. So it's so important to examine the entire breast. So what is the aim of screening? The aim of and importance of screening is to identify individuals with abnormalities suggestive of a specific cancer or pre-cancer. Now, screening is so critical because it can improve early diagnosis, and early diagnosis and prompt treatment makes a difference with saving lives. It also cuts costs, in your treatment. So someone who is diagnosed at a stage 1 has a better survival rate as opposed to someone who would have been diagnosed as a stage 4. But cancer has improved the research. We have had a lot of research, and the prognosis is much better now. It's no longer like a death sentence as before. So that's the good news. So how do we diagnose breast cancer? We normally do a physical exam. The medical professional will also do a breast self-exam. Sometimes they may recommend a mammogram or an ultrasound. They will check your blood count. There's a specific tumor marker called the CA 15.3, which is specific to breast cancer. And there are others for other types of cancer, if it's colon or uterine, ovarian, there are other types, but this one is specific for breast cancer. Sometimes they may order an MRI, a CT scan, a PET scan, or there's something in Trinidad now called breast tomography, which is relatively new on the market, and I'll talk a bit more about that a little later on. Now, I want to pause here to spend 2 minutes to talk about inflammatory breast disease. Inflammatory breast disease is a rare and very aggressive disease in which cancer cells block lymph vessels in the skin of the breast. Now, I remember meeting a client some years ago who was diagnosed with inflammatory breast disease. And what is so significant about this one is that there is no lump. There is no lump. So imagine that you're doing your breast self-exam every month, and what you're looking for a lump. But what about if it's inflammatory breast disease? Now, she said to me, nurse, my breast felt different. My breast felt funny. So I went to my medical practitioner. So I'm saying to you on the platform, any change, you know your body best. Any change, if you feel different, if you feel funny, something is not right, sometimes you get that gut feeling, you take control and you initiate. Because she went to her physician, he did the exam and he didn't feel any lumps. So he said to her, well, I'm not feeling any lumps. So he didn't think, it was anything cause for worry. But her family history, she said to him, she said, my sister was diagnosed with ovarian cancer. My mom had ovarian cancer. So, of course, she would be concerned. So I said to her, well, why didn't you go directly to a specialist? She said, well, my insurance would only honor a claim that's where they would have gotten a referral from the GP. So she needed that referral. She said, after about a month, the same thing happened again. She went back. The doctor said the same thing, you're probably worried, there's no lump. And he didn't give her the referral. She said the third time it happened, she said, you know what? I am going to tell him this morning, just give me the referral. So she left home to go, but on the way she said, she was impressed to go to Cancer Society. So she went to Cancer Society. They said to her, well, they know you need an appointment system. She said, but I'm already here. I already took time off. They said, okay, wait. So she was seen that day. She had a mammogram and they said to her, can you afford to do an ultrasound? She said, sure. And she said, she's looking at the technician's face and she knows that something is wrong. And she's looking at the screen and she's seeing something like a pumpkin seed spreading out. Now, she's not a medical person, but somehow she knew something was wrong. So she was diagnosed with inflammatory breast disease. And in 10 days from that day, her both breasts were removed. It was such a traumatic experience for her. This is what the inflammatory breast disease looks like. It looks like for those who would have breastfed and experienced a mastitis, this is what it looks like. So there's redness involving more than 1/3 of the breast, pitting or thickening of the skin of the breast so that it may look and feel like an orange peel, a retracted or inverted nipple, one breast looking larger than the other because of the swelling. And in her case, when they examined under her breast, she had such a large pit under her breast, just where the breast tissue joins the skin of the right under there's an area where your breast join the normal part of your body. Right in there was a deep pit that she never saw, even though she's examining her breast all the time. And of course, obviously, the doctor didn't realize it either. So please remember, inflammatory breast disease, very rare, 3% of women are affected by this. So the importance of the mammogram. So
Angela, before you move on, somebody sent a question here. Do you have to squeeze the nipple to determine if you have a discharge, or it will automatically discharge if you have a problem?
Yes, some people have an automatic discharge and they will tell you, fluid is leaking from my breast. But sometimes we recommend that when you're examining the breast that you actually squeeze the nipple, because sometimes you don't see it unless you squeeze the nipple.
Okay.
Yes?
Okay. Yeah, go ahead. I guess the person will have heard you. Yeah.
Thank you. Right. So the mammogram is a very powerful tool to detect breast cancer. But, like everything else, it's not perfect. And sometimes, they're not sure and they will recommend a biopsy. This is recommended for women from the age of 40. However, we have been getting so many young persons, like in their 20s, with breast cancer, and even younger than that, teenagers. We recommend that if you have a strong family history, that you start having your exams from your 20s, and it's recommended that you do an ultrasound as opposed to a mammogram. Ultrasound is recommended for the younger women in their 20s. So what happens if I find a lump? Okay, so lumps or any different feel is a valid reason for concern. But then there are women who say, but nurse, I have lumpy breasts. How would I know the difference? And that's a very good question. Now, if you have lumpy breasts, and that's very common, and you're examining your breast every month, you would get used to where the lumps are. So once you feel something different out of place, you know that there's cause for concern. But not every lump that you find is a malignant lump, because they are cysts, they are fat lumps. So sometimes it's not a malignant lump. But once you feel a lump, you need to investigate it. Then we also have the breast ultrasound, as I said, which is recommended for younger women. And these are the methods that are used to diagnose. Now, I would have mentioned breast thermography before, and this is available in Trinidad now. This is a non-invasive and painless test that doctors sometimes use to monitor for early changes that could indicate breast cancer. And this works by detecting increases in the temperature. This uses digital infrared imaging to detect subtle changes in the breast by revealing areas of heat and cold. And as I said, this is also available here. In the body, areas of high or fast flowing blood will show on the thermograph, as being warmer than other areas. Okay, so when a tumor develops or cancer cells grow, these cells need additional blood because normally they grow faster than your normal cells. So this is the method this is the pathology behind this method. So a tumor will therefore appear as a hotspot in thermography images. Okay, let me go on to show you. Now, this test cannot confirm that cancer is present. It can only show that there are areas that need further investigation. So these are some images. Let's look at the normal image. Persons with fibrocystic breast, which is the lumpy breast, and then those with the early stages of a malignant tumor. This is what it looks like. So recent research found that infrared imaging of breast cancer could detect minute temperature variations related to blood flow and demonstrate abnormal patterns associated with the progression of tumors. Okay? Treatment options. So the treatment options are either surgery, chemotherapy, radiation therapy, hormone therapy, and I don't have it here, but some people prefer to use herbal therapy. Okay, so let's look at surgeries. What type of surgeries are normally done? Now, most patients with breast cancer have surgery to remove the cancer. We could have either what we call a lumpectomy, which is removal of just a lump. So if you look at this first picture here, let me get my pointer to show you. This first picture here, right? This is a tumor, and they may just have a lumpectomy where they just remove this lump here. So you see all the lymph nodes running here, and you see how the lymph nodes are running under the arm, and it's a lymph node that is used, for the cancerous cells to get to the other areas. Then we could have some people who may have what you call a partial mastectomy, where part of the breast is removed, right? So you have a partial mastectomy. Then you may have what you call a total mastectomy, where the entire breast is removed. And then there is a radical mastectomy, where the breast and the lymph nodes, you see, the breast and the lymph nodes are removed. And the patient I spoke to you about with the inflammatory breast disease, she was a stage 3B, and she had to have the total mastectomy, and also she had to have about 16 lymph nodes removed. These are some pictures of women who would have had mastectomy. So the first one would have been, just one side would have been removed. Look at this picture here. You're seeing a print of the person's ribs, and hence the reason for showing the very first slide where we dealt with the anatomy of the breast. This person, the muscle was also removed, hence the reason for seeing the ribs. So this is what you call a bilateral mastectomy, where both breasts have been removed. And as you see here, this is a very young girl. So the age seems to be getting younger. This is a slide with men who would have had mastectomies. Can you see? Yeah, each one would have had a mastectomy where one breast was removed. So there's also the option of chemotherapy. And what chemotherapy does, it actually, prevents the cells from dividing or either kills the cells. But we know what happens. It also kills some of the normal cells. So chemotherapy can be taken by mouth, and a lot of breast cancer patients are put on oral chemotherapy for 5 years, which is quite effective. Some people get it via the vein, IV. Then we have radiation therapy, where we use high rays, like an X-ray, to actually kill the cancer cells from growing. But it also, destroys healthy cells that are around. Chemotherapy can be done externally, or it can be done internally. Sometimes some of the radiation, we call them like seeds, they're placed like sometimes in the prostate or different parts of the body. So it can also be done internally. And then there's the hormonal therapy, which has been very, very effective and quite successful for the past 30 years. Now, we recommend breast cancer counseling for anybody who might be impacted by someone with breast cancer, not just the client, but also probably their spouse, their parents, the children, their loved ones, their friends, anyone impacted, their co-workers, anyone who would have had a good relationship that is impacted by this person's experience. We recommend that counseling can help. Now, the good news about breast cancer is that in recent years, perhaps coinciding with the decline in prescriptive hormonal replacement therapy, because this was given automatically to a lot of women who would have had really horrible symptoms, during menopause. They would have been giving you prescriptions for hormonal replacement therapy. And we saw on the list before that they realized that taking this hormonal replacement therapy contributes to a diagnosis of breast cancer. So it's not used as much today. So we have seen a gradual reduction in the female breast cancer incident rates among women over 50. So the death rates from breast cancer have been declining since 1990, and it's part due to better screening and early detection, increase awareness, like what we're doing this morning, making people aware. Because once you know you're informed, you would make informed choices. And once you continue to do your screening, we have seen a great reduction in the death rate also. So this slide here shows women who have actually had post-mastectomy breast reconstruction.
Angelique, me again.
Sure.
Most of our audience are on radio, so you have to be a little more descriptive with the slides on them.
Okay, they're not seeing the slides.
Yeah, what are on the radio? So
okay, sorry.
Those who are on Facebook and Instagram and YouTube, fine, but there are a large body of the listeners who are
on YouTube. Okay, sorry about that.
Right.
Showing here is a photo of so they would not have seen the slides with the persons with the mastectomy, and so.
No, they would not have seen anything so far. But you are doing well, I'm not saying that you are doing well, but I want you to be conscious of it. That's all. But what you have done so far, even with the slides, you are doing very good description of it. But I just want you to be conscious. That's all I'm trying to get you, because there are people who are not seeing anything.
So this slide I'm showing is women who would have had a post-mastectomy breast reconstruction, and there are a lot of things available now that you can use. You have the prosthesis that you can use. The woman who is not in favor of doing the breast reconstruction, there are bras with the prosthesis. The breast, it looks very normal. It looks like human skin, and when you wear them, people would not know, but it gives you a sense of normalcy. When you put your clothes on, you don't have this flat area. Sometimes they feel people looking at them, they're looking different. So there are a lot of things now available. As I said, these bras, as you look at these clients here, you cannot tell that they had post-mastectomy reconstruction because they look very normal. Yeah, so there are a lot of things now in the line of prosthesis that women could use that were not available years ago, so that they can have a sense.
But what happens when a woman she loses for both breasts and she is of childbearing age? What happens with that natural formation of milk that happens when a woman becomes pregnant? What happens?
Okay, so some women agree to have the reconstruction at the same time the breast is removed. That is done sometimes, or sometimes they do it after. Now, once the breast is removed, you don't have breast tissue, you don't have ducts, you cannot breastfeed. You do not have that option to breastfeed because you do not have a breast. We have had women who got pregnant after removing their breasts and very successful, but they do not have that option to breastfeed because their breast tissue has been removed, so they will bottle feed. So that's what I am aware of. I have never heard of anything else besides that. Does that answer the question?
Yeah. I see. As you are speaking, there are things that I'm seeing here for the very first time. I wasn't even aware that breast cancer was a prominent thing among women, because I hardly hear women speak of breast cancer. I hear it, but not in a way that how you are saying how prevalent it is. So I wasn't aware. So now, as you are speaking now, the questions are coming to me.
Yeah,
Mine is wandering everywhere.
1 in 8, and I don't know what's the size of your audience, but just imagine 1 in every 8 women here this morning could be diagnosed with breast cancer in their life.
That's the challenge of me while you are saying this, because 1 in 8 is pretty high. And if this is happening at such a rate, I'm asking myself why I'm not hearing about this more.
A lot of work is being done with breast cancer. Every year we have a lot of organizations, they promote, they have runs, they have walk, they have free testing, they have free screening, a lot of organizations, a lot of banks. So it's very, it's all out there. It's all out there. They wear pink. They have a lot of marathons. So it's all out there, because 1 in 8 is very high. So everybody on this platform this morning at least know one person with breast cancer, right?
Okay.
On this platform, every person at least would have known one person with breast cancer. It's very, very common. Okay, so let's go ahead. So most of us, on hearing the word cancer, we tremble, we get fearful, we feel depressed. But let's change the narrative this morning. Yeah? Let's change the narrative. Do what you must. Let's prevent it. Let's fight it. Okay? Start today. Follow these steps. Know your breast. You know your body better than your physician. If anything, anything that's different, anything that's uncomfortable, anything that's, if you go to one person and you find you're not getting the satisfaction, go to another person. And that is what this lady did. Yeah, because she didn't sit down and say what the doctor said is okay. She followed her gut, and she was already at stage 3B. If she had waited longer, it would have been a different outcome. And, I'm happy to say that she is alive today after 11 years. Yeah. So know your breast, perform your monthly breast self-exam. Yeah. Exercise at least 30 minutes, 5 days or 5 times for the week, because we have seen the relation between, you're keeping your body healthy, drinking enough water, getting your exercise, getting your sunshine, getting enough rest, taking care of yourself. And I always tell women, we don't only have the bank account in the bank. We have an emotional bank account that needs to be filled. We have a spiritual bank account that needs to be filled. We have a social bank account that needs to be filled. And we have a psychological bank account that needs to be filled. So under the physical bank account will be your diet, your exercise, your water, the sunshine. Under the social bank account, what you're doing for yourself socially, what do you do for yourself for fun? Do you have friends? You go out with your friends. What you do for fun? Have fun with your family. Then the psychological, pamper yourself. See about yourself, see about your skin, do your hair, do your nails, do a massage, see about yourself. And of course, the spiritual, your spiritual bank account, which involves prayer, worship, reading Bible study, whatever your spiritual orientation. So we need to have all these bank accounts filled and up so that our bodies will be at the best to ward off all these things that are exposed to, right? Your annual screening is important. Now, I know years ago, they would say to women, like, let's say, I'm not talking about cervical cancer, but I just want to throw in this here. They would say to you, if you have 3 normal pap smears over for 3 years consecutively, you could have a 3-year break. And I personally don't believe in that, because I have seen clients who had 3 normal pap smears and then they waited 3 years, and the 4th year when they reach stage 4 cancer. Do your pap smear every year. Do your breast check every year. And I would also say do blood tests for things like ovarian cancer, the CA125. Yeah, because normally with ovarian cancer, by the time you're diagnosed, you're already stage 3. Most of the women, by the time they get symptoms and they diagnose, you're stage 3 and going. So every year when you do your medical, you want to do your breast exam, you want to do your pap smear, you want to do your CA1 to 5, you want to do an internal ultrasound or an external ultrasound of your organs, your abdominal organs. That's my recommendation. And if you've been diagnosed, you see a physician, they will normally, involve physiotherapy and all the different specialties that you need to support you. And help is available at the Trinidad and Tobago Cancer Society. They're doing an excellent job there.
Is breast cancer preventable?
Is it preventable? I would say no. And I say no in inverted commas, because if you have a family of breast cancer, even without the family history of breast cancer, every condition, every disease, it depends on your immune system and how how you take care of yourself, that, you may probably prevent it. You might keep it off for a longer time. And let me just use an example. I remember there was a client diagnosed with ovarian cancer. And she said to the doctor, she said, I feel so cheated, because she said, as a young person, I took the decision to become a vegetarian after doing some research and choosing to be a vegetarian because she felt that that was a healthier lifestyle. She denied herself from eating red meat and all of that. And she said, I felt so cheated, because sometimes I could do with a good beef burger. And I, felt, well, because of my family history, because in her family was the mother, the sister, the aunts on both sides. So she took a decision early. And then what the doctor said to her, he said, thank God you were living that lifestyle, because you would have been in big trouble. That's what he said to her. So I believe that the lifestyle could probably hold it off, or probably could help you to cope with it better if it happens. That's my personal, and I don't have any research to back up what I'm saying here. So don't say that, don't quote me to say that.
Another thing, Andrew, I know you said that you are dealing with breast cancer, but I heard you mention ovarian cancer a while ago. Are there any symptoms of that? Even if that's your field, we move on. I just wanted to know, since you are here already, I might not get you back here again. Right. So let me squeeze the orange for everything it has. Ovarian cancer. What's that?
Why I mentioned specifically ovarian cancer, I would have mentioned it in one of these slides. We have been seeing a lot of sisters, one with ovarian, one with breast. A lot of couples, a lot of sisters, one with ovarian, one with breast. And it is normally not a nice combination. One with ovarian, one with breast. We have been seeing that a lot. So what the doctors would advise, they would advise his sister who had ovarian, they would probably ask them to do a prophylactic removal of the breast. Well, that's after they would have done studies, they would have done BRCA tests and see if you qualify for that. And those who would have had the breast cancer, they would ask them to remove their ovaries, because you find we have a lot of sisters, one with ovarian, one with breast. And that is why I mentioned ovarian. And what we also saw, that some people would have gotten it in their breast, they would have gotten treatment for the breast, and 5, 6, 7, 8, 9, 10 years after, it coming back in the ovaries. So that is why I would have mentioned ovarian cancer. Somehow there's a connection between the ovarian and the breast. That's why I mentioned it here.
Okay, thank you.
Okay, so thank you so much, Pastor, for this opportunity. I hope that what I shared here, it would have been a reminder for some persons. It may have been new information for some persons. However, I always say, if one person benefits from the information, it would have been worth it. Thank you.
All right, let me see if we have anybody who want to give us a call. Alex, good morning.
Good morning, Pastor. Good morning to your guest. And of course, yes, we do have a call coming in. So let's take this one time, 622-4911. Let's take some calls right here at the program Victorious Lifestyle. Good morning. Morning.
Yeah, good morning, Pastor. I listened to the program. Very, very interesting. I just would like to ask the lady there, I want to thank her, but I want to ask her one thing. If there is a relationship between using deodorants and underarm things of perspiration and breast cancer. Thank you very much.
Good morning. Thank you so much for your question. Very interesting question. I get asked that question all the time. Now, there's a lot of information out there saying that the underarm deodorant is connected to breast cancer. However, I do not have any research that I can quote from to share with you this morning. I do not like to quote certain things without having, the support of research that was done that I can share with you. But there's a lot of theories out there saying that there's a connection between your underarm deodorant and breast cancer, and they recommend certain types of deodorant without what they said it was. Is it there's a particular thing that they said is in these deodorant that are healthier than the regular ones. So if you believe that and that's your persuasion, I would say go with your gut and how you feel. But I do not have any research this morning to share with you supporting yes or no. So I hope that really answers your question.
All right, we have another call coming in here. Let's take that right away. Good morning.
Good morning.
Mr. Alex, a blessed morning to you and to Mr. Pastor Brown and to the Miss. You have done you simplified your explanation on cancer.
Thank
but
you.
you see certain things in life, we all just irritate our very own selves by wearing tight clothes. Some ladies wear tight brassiere, tight shoes, and when you wear these tight things, your blood cannot circulate properly. You mustn't wear it too tight and too slack because each one does irritate you. And the attitude, how you explain that, I have a doctor named Pat from Sandale Avenue in Diego Martin. And when I go to she, every 5 years I could go back to she. That is how nice and kind and you all as God send people in. Each one of us are a child of God. And when we could stand and be our brothers and sisters keepers, like how you explain things, we are the people that cause all problems to our very own selves. What we eat, what we drink, and our lifestyle must be perfect because we're born perfect as a child of God. And Pastor,
yes, sir.
I have one thing for you to talk about too. You see the 4 guys who died in that pipeline and the whole of the Trinidad and people, what's that death?
Mm-hmm.
I want to talk about that too.
Trauma.
I want you to talk about that too. Please do that.
Yeah, we'll talk about trauma one day and we'll bring up that.
Them fellas do billions of dollars for that company, and what will they get? Death? You have a blessed and wonderful list too.
Yeah, man, you too. Alex, anybody else?
Not at the moment. You can close off, Pastor.
All right. Yes, it's almost time. So I just want to ask one other question before we leave, Angelique, because we almost 10 o'clock. Are all type of cancer, somebody's asking this question, are all type of cancer screening available at the Cancer Society, even blood test for ovarian? What is done? All type of cancer?
Yes, screening is available. The treatment for cancer in Trinidad for breast cancer specifically, is on par with internationally. For breast cancer, some of the rare ones, you find that they may have to consult away, they may have to send the blood tests away. But all the basic ones, prostate, cervical, breast, all these things are available. And even your private lab, you could go to a private lab and get a CA 125. You could get one for the liver. There's one for the liver. There's one for the as I said, the 125 is for ovarian. You can go to any lab and get all these tests are available. All these tests are available, right? Okay. And as treatment for breast cancer in Trinidad and Tobago is on par with the international standards.
Okay, I want to thank you very much. We got to run because this is carnival season, and I think the radio is booked for all these sort of programs. So we got to go. I want to thank you again for coming. Thank you. You know why I'm thanking you so much. So I want to thank you. And I want to thank all those who continue to support the program in each and every way. And may the good Lord continue to bless us. And I'll see you next week. Same time, same place. And Angelique, we'll get back to this sometime in the future. We'll get back. So God bless you and your family. Bye-bye. Alex, bye-bye also. Be blessed.
Thank you very much, Pastor. Enjoy the rest of your day, and to your guest, Angelique. Thank you very much. The program Victorious Lifestyle here on Talk City 91.1 FM as we return to a regular